for joining today's conversation. My name is Simone Snead, and I am the Maternal Mortality Review Community Action Team Coordinator for the City of Philadelphia Department of Public Health. I am also a certified doula, and I'm a member of Alpha Kappa Alpha Sorority Incorporated Phi Beta Omega chapter. I'm really excited to speak with you today about the maternal health crisis in the United States and how it's impacting African American women specifically. So honestly, the first time I heard the statistic, African American women are 3 to 4 times more likely to die of pregnancy-related complications than white women, it shook me to my core. And that's the reason why I delved into the birth world and became a doula and wanted to learn as much as I could about maternal health in the United States. So today I'm going to be sharing with you a lot of the gems that I've learned. So we're going to speak about maternal morbidity, maternal mortality, and what that looks like. We're also going to speak about what's going on in Congress and ways that we can advocate for ourselves. So I'm going to jump right into definitions because I want to make sure that we're clear for the remainder of our conversation. So maternal mortality is the death of a woman during pregnancy or within 1 year of the end of that pregnancy. So this is regardless of the outcome, duration, or the site of the pregnancy. And it's typically due to a pregnancy complication, a chain of events that are initiated by pregnancy, or the aggravation of an unrelated condition by the physiologic effects of pregnancy. And sadly, about 700 women die each year in the United States as a result of pregnancy or delivery-related complications. Unfortunately, this was the fate of Kira Johnson, who was a marathon runner. She spoke 5 different languages, she raced cars, and she was a wife and a mother. Kira passed away on April 12, 2016, after giving birth to her second child via cesarean. After continuously alerting medical professionals of her condition, Kira's husband became her biggest advocate. He wanted to make sure that she was safe. And unfortunately, there was a time lapse in between the time where he requested that doctors do a CT scan and when she was actually given an internal exam. In that time period, there was about 3.5 liters of blood in Kira's abdomen. And when she was finally taken back to the operating room, she did not return as her family had intended. And like this death, over 60% of maternal deaths are preventable. And the United States, we're one of the wealthiest countries in the world, and we spend the most on healthcare than other countries. So why are the rates of maternal complications and survival among the worst? To understand this maternal mortality epidemic, we must also understand maternal morbidity. So maternal morbidities are those unexpected outcomes of labor and delivery that result in both short and long-term consequences to a woman's health and well-being. So each year in the United States, more than 50,000 women, so if we break that down, it's about 135 women each day, experience those unexpected complications that result in those short and long-term health problems. Rates of maternal morbidity are increasing partly due to the worsening trends in maternal health. So we have increased obesity, we have diabetes, hypertension both during and after the pregnancy. We have the increased use of cesarean delivery, which has increased from about 6% in 1990 to about 21% today. We have increased use of induction and augmentation of labor, and there are significant racial and ethnic disparities in healthcare. So a lot of times when Black women are complaining of pain, medical providers simply don't believe that their pain is as horrible as they are explaining it to be. So it's really important that we are communicating, one, what's wrong with us very well, and medical providers are checking their biases and believing Black mothers. So by now, I'm sure that many of us have heard of the birth stories of Beyonce and Serena Williams. Both women are at the top of their respective fields, Beyonce has won 24 Grammys, and Serena Williams has won 23 Grand Slams. But one thing that they both have in common, besides being African American women, are that they have both survived potentially fatal pregnancy complications. Beyonce had an emergency C-section with her twins due to preeclampsia or high blood pressure. And Serena Williams suffered a pulmonary embolism and had to have an emergency C-section due to blood clots in her lungs. These women have shown us that it truly doesn't matter who you are, how much money you make, the amount of degrees that you have, or how many languages you speak. Black women are 3 to 4 times more likely to die of pregnancy-related complications than white women. We need to advocate for ourselves. One way to advocate for yourself is to have a doula. So what is a doula? A doula is a companion or support person during the pregnancy, labor, and postpartum periods. And doulas offer continuous physical, emotional, and informational support. And whenever I'm speaking to one of my doula mamas, I always say that it's the best pyramid that you could ever ask for. Your doula is helping you move around physically while you're going through excruciating pains. Your doula is supporting you emotionally, making sure that you are prepared and ready to deliver your baby boy or girl. And your doula is offering you informational support on what will happen to your body after you deliver a baby, what to expect, and what medical providers are speaking about. So sometimes moms will ask clarification on a term that a doctor has used. I always tell moms to ask the doctor to explain it step by step so that, one, they can be clear in knowing that, okay, well, the doctor or midwife should explain step by step what this process is, and you're also advocating for yourself so you know, okay, is this something that I think that I should do for my body? We know our bodies better than anyone else, so we need to advocate for ourselves. And one way of advocating for ourselves is also knowing what's going on in Congress. So there are many bills that are currently in the House and in the Senate that are thoroughly explaining what's going on in maternal mortality, the racial disparities, and what we can do going forward. One of those is the Helping Medicaid Offer Maternity Services Act of 2019, so the Moms Act of 2019. This was introduced to the House, so it's a House of Representatives bill, and it's HR 4996 if you wanted to look it up. The sponsor was Representative Robin Kelly. He's a Democrat out of Illinois, and there were 24 co-sponsors. So the purpose of this bill allows for states to provide 1 year of postpartum coverage under Medicaid and CHIP. The Moms Act of 2019 also supports research on doula coverage via Medicaid. There are no funds being requested for this bill, and it was approved by the House Energy and Commerce Committee on November 20th, 2019, and this will be followed by a committee report. So please be on the lookout for that. And like I said, that was HR 4996. Also, we have the Healthy Maternity and Obstetric Medicine Act, and this is actually in the House and in the Senate. So if you wanted to look it up in the House, it's HR 2778, and if you wanted to look it up in the Senate, it's S1481. The representative that introduced it to the House of Representatives is Bonnie Watson Coleman, a Democrat of New Jersey. There were 87 co-sponsors on that bill. And it was introduced to the Senate by Senator Sherrod Brown, a Democrat of Ohio. And there were 24 co-sponsors. So this bill would create a special pregnancy enrollment for care. It extends Medicaid coverage for up to 1 year postpartum and extends policy changes to private insurance plans beyond Medicaid. There are no funds requested for this bill, and it's currently under review in the House and in the Senate by various committees. And then the last one that I wanted to touch on today was the Mamas Act. So if you wanted to look up the Mamas Act, it's in both the House of Representatives and the Senate. In the House of Representatives, it's Bill 1897, and in the Senate, it's Bill 916. The sponsor for the House of Representatives was, again, Representative Robin Kelly, a Democrat of Illinois. It had 109 co-sponsors, and in the Senate, the senator who introduced that bill was Senator Richard Durbin, a Democrat of Illinois. There were 16 co-sponsors. This bill states to extend Medicaid coverage to 1 year postpartum, establish and support implicit bias training for healthcare professionals, and funding for state-based perinatal quality collaboratives. The funding for this bill would be $150 million over a 5-year period. This bill is supported by 60 plus health organizations, and Senator Durbin actually requested for this bill to be passed immediately on March 3rd, 2020. This bill was referred to Subcommittee on Health on March 28th, 2020, so we are waiting to see what happens with the Mamas Act. I really just wanted to give you all an overview of what's going on in Congress in terms of maternal health, because a lot of these, in their description, they speak about maternal morbidity, they speak about maternal mortality, and how it impacts African American women. They also speak about the implicit bias that happens with healthcare providers. So it's really important that healthcare providers get this training, because sometimes people don't realize that they hold biases until they're called out on it. It's really important that we're advocating for ourselves, so make sure that you have a doula. Make sure that you are speaking to someone. Make sure that you are talking to healthcare providers about your care and what you want. And make sure that you have someone there that can advocate for you as well when you feel as though you can't. Doulas have been shown to not only support moms, but having a doula, studies have shown that they have lower rates of cesareans, shorter durations of labor, because a lot of times they're assisting moms laboring at home. There are lower rates of receiving an epidural, and ultimately there are fewer complications. So we really want to make sure that people are advocating for themselves and they have someone else to advocate for them as well. So how do you advocate for yourself in this situation? So try to develop the best possible relationship with your healthcare provider as possible. Speak to your provider about your plans. They will let you know whether or not you can do this, or if they don't think that you could due to your condition. Second, trust your body. You know your body better than anyone else, mama. So communicate with your provider what's going on with your body if you think that that's a good position. Speak to your doula if you have one. Just make sure that you are comfortable at all times and be confident in communicating when you are uncomfortable. If you are a provider, try your best to acknowledge your own biases. Mama, consider a doula to have a support person during labor and delivery. Do your own research in addition to what the providers tell you, because that will assist you in understanding the process a little bit more. When you know if a doctor is saying, oh, well, yeah, you have hypertension. Hypertension is high blood pressure. Some people don't know that, but making sure that you are delving into literature just as much. If they tell you that something's wrong, it's okay to ask for a second opinion. And when choosing your birthing location, look into all aspects so you can have a hospital birth. You can birth at a birthing center, or you can look into home birthing options. All are available to make sure that you have the best birth possible. All we're asking for is a healthy mom and a healthy baby. It's not too much to ask for, because no mom should die while giving life. We do want to make sure that people have the best resources possible. So if you have any questions about anything that I said during this video, please don't hesitate to leave a comment below, and I can try my best to point you in the right direction. Thank you.